When you are pregnant, your body goes through a lot of changes. Sometimes, these changes can cause problems for you and your baby. During pregnancy, some women develop a special type of diabetes called gestational diabetes.
Gestational diabetes is a condition which is characterized by high blood sugars occurring for the first time during pregnancy.
Your body produces something called insulin, which controls the level of sugar in your blood. Because of changes occurring in the body during pregnancy, in some women, the insulin can't work properly. As a result, the level of sugar, sometimes called glucose, in your blood can get too high. This is called gestational diabetes. If your blood sugar is too high, it can be harmful to you and your baby's health. The high blood sugar can result in your baby growing too large, making birth more difficult. It can also increase the chance that you and your baby will suffer from diabetes later in life.
Yeah, most times when the babies are born, they are relatively bigger than usual babies, what we call macrosomia. And that means their sugar levels have to be strictly monitored.
Gestational diabetes can be treated, reducing the risks to mother and baby. However, it can only be treated if it is diagnosed. You are more likely to get gestational diabetes if you are overweight, if one of your previous babies was larger than average, or if you have a family member with diabetes. However, any woman can develop the condition during pregnancy. Because most women with gestational diabetes do not have any symptoms, it is important that all women are tested for the condition as early as possible in their pregnancy.
Prevention number one still remains on encouraging our mothers to start antenatal early, to screen these mothers in the right time between especially 24 to 28 weeks. And those who are diagnosed positive, we give them health education on diet and exercise. That's the only way to prevent screening, early screening.
So, Kannada less sugar than Coca-Cola.
To test for gestational diabetes, we use a test to see how well your body uses sugar. The test will involve drinking a sugary drink and then having a simple blood test taken 2 hours afterwards to test your glucose or sugar level. This test should be done on all pregnant women. It should be done for the first time early in your pregnancy and then again later in pregnancy, around 24 to 28 weeks. Although it is best to do the first test as early as possible, a test can be done at any time during pregnancy. If you have not yet had a test, ask your doctor.
On the first screenings, we normally tell them this is not a permanent condition. It will disappear after giving birth. Though there are those ones who can get type 2 if they are not managed well. There are those results that can be managed through exercise and diet.
For the first 3 months of pregnancy, you don't need to eat any more food than you did before pregnancy. From the 4th month, you can increase the amount of food you eat by a little bit. It can be helpful to eat smaller meals more often, maybe 3 meals and 3 snacks each day. Healthy meals must include plenty of vegetables and fruit, as well as food that gives you protein, like eggs, meat and fish, and dairy like milk and yogurt. One important food group is called carbohydrates. Everyone needs carbohydrates in their diet. These foods give you energy. You should try to choose healthier types of carbohydrates, such as brown rice, matoke, yams, and sweet potatoes.
We advise them to reduce on carbohydrates like cassava, posho, and to take a lot of vegetables and fruits.
Try to limit less healthy carbohydrates such as white rice, white bread, pasta, and fried foods like chips and mandazis. Keeping active during pregnancy will benefit you and your baby. Any physical activity is better than none. If you are diagnosed with gestational diabetes, being active for 30 minutes a day is the best way to control blood sugar levels. Try to find the time in your day to take a regular walk. If you are diagnosed with gestational diabetes, regular exercise and eating healthily might be enough to keep your blood sugar under control. However, you will still need to see your doctor or nurse more than usual, and you will need regular blood tests to check the level of sugar in your blood. A small number of women who are diagnosed with gestational diabetes may need to take medicine. This might mean you have to take tablets each day or give yourself injections. It might sound scary, but women quickly get used to it.
You really have to have that heart of having a healthy baby and then healthy you. So it is not easy, what I can say. But at the moment, I'm getting used to it.
The medicine is safe for you and your baby and will help to keep your blood sugar under control. In most cases, you can stop this medicine after your baby's birth. If you are diagnosed with gestational diabetes, it is normal to feel stressed and anxious.
It wasn't an easy thing to get over. I was kind of heartbroken, and because I had really tried my level best to eat healthy, I had tried to drink healthy, because this time around I wanted to avoid again having a very big baby.
Try to stay positive. Ask your family to support you to make healthy lifestyle changes.
Meat ration, we can have fish.
Gestational diabetes is a common condition and can cause problems for you and your baby. Be aware of the condition and make sure you are tested for it. If you are diagnosed with gestational diabetes, it can be treated. Pregnancy is a special time in a woman's life, and it is important to do all you can to stay healthy. Eating well and keeping active is important for all pregnant women. It will help to keep you and your baby healthy.